Okay, hi everyone. Welcome to the Early Years Transformation Academy. Hopefully you can hear us and see us okay. So as you're joining, just get yourself acquainted with what you can see, so you should be able to see our image nice and clearly and should be able to hear us. If anyone has any difficulties with that, there is a chat box and it should be either to the left-hand side or the right-hand side of your screen. So feel free to comment in there if there's any technical difficulties. And we'll just wait for a few more people to join. So hi to all of those that have joined thus far. My name's Miriam. I'm the events coordinator at the Early Intervention Foundation.
And I'm Ben Lewing. I'm an assistant director at EIF.
So give it a couple more minutes. And so for those of you that have joined, you'll notice that there's also a Q&A box. So I'm just going to draw that up now. So the Q&A box just allows you to add in your live questions. So you can text, type anything in response to the presentation. And the way that this will work, I'll go through this more in a minute. We'll go through questions at the end, but feel free to write your questions as they arise. Looks like everyone can hear, which is great. So it's going to give it a couple more minutes. We've currently got 11 people joined. We're expecting a few more. So hi to the new participants that have just joined. As I've just said, just make sure you can hear us and see our picture nice and clearly. We're just waiting for the last few people to join before we get cracking with the presentation. So you should be able to see that you're muted. So if you're okay to keep yourself muted for the duration of the webinar, that'd be really helpful. And then there is a live chat box and also a Q&A box. So you can type in your questions as they arise, and we'll be going through these at the end. Okay, so we'll get started. So we're going to work through a presentation, which Ben's going to speak through the Early Years Transformation Academy prospectus. But before we get started, I'm just going to go through the basics. So for some of you, this might be the first webinar you've attended. And if that is the case, then as I've mentioned, just keep your microphones muted at all times. And you're welcome to submit your questions as they arise in the Q&A box, and we'll be going through these at the end of the presentation. If you do have technical problems, just click, there's a little raise your hand button, and that will just notify us if you're having any difficulties hearing us or seeing us. Just to note, this webinar is being recorded, so if for any reason you are having difficulty hearing or seeing us, we're going to be able to upload this later, and you can share among your colleagues or just return back to it if that might be helpful, so don't worry. So I'm going to pass over to Ben now, and he's going to talk through the agenda for this presentation. So yeah, take it away.
Okay, fantastic. Thank you very much for joining us today. It's rather strange talking to you but not seeing you, but I'll do my best. Okay, so I'm going to work through some of the detail that is in the prospectus for the Early Years Transformation Academy. So hopefully you've all had sight of that and have access to it now. So I'm going to introduce the Academy. I'm going to focus particularly on whether the Academy is right for you. I'm going to talk a little bit about how the Academy will work, and then I'm going to talk through the process for making an application, in particular the first step of that, which is submitting your expression of interest. And then, as Miriam has said, we will work through all the questions that you've posed us at the end. And hopefully you should be able to see each other's questions as well, which is always helpful in a webinar, I find. Okay, so the Academy itself has two parts, and we're going to spend most of the time looking at the first part in this slide, so the applied strand, which is the intensive support for multidisciplinary leadership teams to prepare a local transformation plan. But there is also another part to the Academy, which is a learning strand, which is a series of evidence seminars and online materials for the wider stakeholders with an interest in this. We've been very struck by initiatives like A Better Start, amongst others, where it often feels like there's a huge amount of interesting learning going on, but you can't find out what it is. So we want this to be a transparent learning process for the wider set of stakeholders with an interest here, not just the people going through the intensive steps. So the Academy itself, well, first of all, it's designed to help you to build on local strengths in your maternity and early years system. It's a 12-month intensive applied program to support you to identify your areas for development and tackle them with a change plan. In fact, the program takes you to the point at which you are ready to deploy your change plan. So in that 12-month period, it's all about the planning, at which point you're ready to implement. It provides access to independent expertise in the range of things which we feel are important to support the change process. In particular, looking at the latest available evidence on child development and implementation too. All of this brought together with the goal of helping you do something very practical, which is local transformation. So it's not an academic program. It's not theoretical. It brings academic research and theory to help you with the practical tasks facing you in improving your local system for families. The Academy is built around partnership teams, so multidisciplinary and multi-agency teams who have a local mandate to work together on that system change. And that team represents the stake of the range of interests with a stake in this local system, from maternity through to entry to school. So that includes health stakeholders, education stakeholders, and social care stakeholders in the broader sense. And the Academy is focused on child outcomes from conception through to the end of the early years foundation stage, as I mentioned, looking particularly at 4 domains of children's development: physical, cognitive, behavioural, and social and emotional. I'm not going to go into more detail on those today. Obviously, we've explored those in much greater depth in our evidence reviews, which we've published over the past 5 years or so. And what the Academy is doing is giving us a vehicle to bring our evidence into a coherent structure to help people use and apply those. Okay, so this slide looks at what the potential benefits are for local areas who join us in the Academy. And I'm going to talk about local partners to the Academy because that's the kind of relationship that we're seeking. It's very much a two-way relationship, which I'll talk about as I move through this. So the first benefit for local areas is that it offers you the opportunity to bring a coherent response to your local issues. So the system is complex, has many different strands, often with different drivers, different funders, different timescales. What the Academy will do is help you bring this together in a coherent way, make sense of that diversity of different approaches, and look through a system lens at what is going to benefit families across a range of initiatives. It's also an investment in the longer term, which often hasn't been the case when it comes to maternity and early years services. The local places participating in the Academy will have committed to a longer term approach to a focus on the early years. It's a statement at the local level about the importance of this approach, and it focuses on longer term impact rather than just responding to immediate operational pressures. It also focuses on the individual's role as leaders, system leaders in particular. And it looks at both their roles individually and what they do when they're working together, so how they operate as a leadership team. Some of the people who will be involved in the Academy, and I'll describe who that is in a moment, they won't necessarily see themselves as system leaders because they will be responsible for services. They will see themselves as having part of that system. But in fact, the relationship between the range of leaders within a maternity and early years system is hugely important. How they work together, whether they trust each other, whether they're able to work together in the design and delivery of that system. We will be drawing in particular on support from the Staff College, who are one of the Early Years Transformation Academy partners, in the leadership development component of the Academy. They have a lot of experience focusing on system leadership, individual leadership, and indeed team leaders. So a very, very strong element of the Academy. The fourth benefit is the independent lens, and there are a number of components to this. Obviously, working with an organisation like the Early Intervention Foundation as a What Works Centre, we are independent of delivery, and our goal is to bring evidence to support people to transform their local systems. And the same is true of the partners that we're working with, the Staff College, Born in Bradford, and Better Start Bradford. But it also allows you to access local stakeholders in the regional approach that we're proposing. So to draw on peer challenge, to draw expertise from people doing similar things to you, but not invested in your local area and your local system, to share the journey with others. And then finally, there is an opportunity to work with us in the Foundation on the design of the Academy itself. This is new for us. This is a test and learn. We're seeking people, partners who can help us to develop the approach. This isn't something which is set in stone and established. This is the first time we've run such an ambitious program like this. And we want people who are able to travel that journey with us and help us to design it. But also people who are open to sharing their learning journey on a national stage. There is plenty of interest up and down the country in what comes through the Academy, the journey that people take, what they learn, what they experiment with. And so being open about the things that don't work as well as the things that do is important to us in the Foundation, and also important for the partners that we seek to work with. So you may well have gathered from how we've set out the prospectus, and also from what I've been saying so far, that the relationship with local partners is hugely important to the success of the Academy. It's hugely important to us, because the Academy isn't going to suit everyone. It is intensive, it will be demanding, and for some places the time simply won't suit them, given local pressures and capacity issues, and we recognise that. In fact, we've designed the whole process to acknowledge the fact that for some sites they either won't be able to participate, or if they're making the choice to participate, it's tailored to be as light touch as possible, so people can move through the steps of applying without spending too much time, given that we will only end up with 4 successful areas. But the benefits that I've already set out are, for some areas, will be worth it. And we've identified 6 characteristics, if you like, of local partners, or factors which we think are important for us in choosing local partners, to help us make the decision and to guide you as well. So the first is, we're looking for partners that are committed to using evidence in the design of their local work. And of course, everybody's interested in evidence. I suspect few places would say they're not committed to applying evidence. The challenge here is that for sites working with us, there will be moments when the evidence doesn't support the things that are going on in the local area. And we're very interested in how sites adapt to change what they're doing in response to the evidence. This isn't about suddenly stopping everything and starting afresh, but it is about being open to challenge yourselves when the evidence doesn't support the things that you're doing. And that's really important as part of the academy. The second factor is readiness for new ideas. Some areas will already be part way along the journey, will already have developed a local approach, will have a system design in mind, will be heading in a particular direction. For areas like that, the academy may not be the best fit, because we will take areas from the beginning of this process, looking at needs assessment, looking at what the evidence says about interventions, and working from that point forward. So if, for example, you already have a very robust strategy for where you want to get to in the early years, and you simply need people to get on the bus, to comply, and to deliver that, then this probably isn't the right kind of program for your area. The third factor is about the kind of people that you can bring together to participate in the academy. And here, I guess there are two sets of stakeholders in particular. The most important is the people who would be part of the Transformation Academy teams. They need to have the capacity to engage. They need to have time. They need to have a mandate. They need to be able to work through each of the components of the academy. And they need to come to the academy with a focus on the whole system. So this isn't about individual operational challenges. It is about how all the parts of this system fit together, which requires a strategic mindset. And the other factor in the right kind of people is about the wider workforce. So whether there is sufficient stability in the kinds of roles that are important to this system, so that there isn't constant change, particularly for the core Early Years Transformation Academy team. If a series of people start the program but move on or just not able to complete the program, it will undermine the likelihood of success for the local area and for us in EIF. So having a sense of a stable workforce that has a good chance of starting and completing the program over a 12-month period is important. Of course, things change, and it's natural that some people will move on. But being clear that the workforce feels stable enough to participate in the academy over a 12-month period is important. The other set of stakeholders for whom this is relevant, the right people, is the senior sponsors. So having consistency of engagement and commitment to this across a set of senior sponsors, whether they're directors of children's services or senior commissioning directors in the CCG or senior managers within provider organisations. Each of those has a role to play to make this work, and I'll talk a little bit more about their role later. The fourth factor is really important to us. Some of you may have seen our recent publication on realising the potential of early intervention, and we talk a lot about the challenge that initiativitis presents in local areas. So frequent small-scale funding that requires an application and with a specific set of requirements, but for something very precise and limited in its scope. It's really important that the Transformation Academy isn't just another initiative. In fact, if it feels like another initiative, then it's probably not going to work for you. The way that we've designed the program is that it should be a vehicle for bringing together a range of other initiatives in the maternity and early years sphere, allowing you to bring greater coherence and to consolidate your planning across those initiatives. It has to be a way of binding things together that feels more efficient for you rather than just another add-on. And that's a crucial factor in the success of the academy. The fourth factor then is about senior mandate. And I've already talked a little bit about the senior sponsors. It's vitally important that there is a recognition that participating in the academy is not just for the people who are involved in the intensive work. They are doing something which is about local transformation that requires a wider set of stakeholders, including directors and other senior leaders, to take action as a result. So that mandate, that senior level commitment, is a critical factor in the success of the academy. And then finally, finding neighbours is really important for the academy, because the way that we want to deliver the programme is in the local area, or indeed in the local region rather than the local area. So we've reached the view that one of the key factors that will help sustain involvement across the 12-month period is that it feels locally relevant, and that people don't have to travel great distances to come to academy events. We've seen fall off in previous programmes that we've run where people have to travel a great distance. Now, we recognise that this potentially limits the opportunity for a wider set of local areas to get involved, because we want to deliver it in a single region. That depends on finding 4 local areas in a single region, or at least geographically close together, so that they can come to design workshops delivered in a geographical area. We're not asking you to apply as a set of 4 authorities. In fact, we require individual areas to apply. But we have been talking to the ADCS regional chairs and others to help support the brokering of a regional or sub-regional approach. And we will put people together into 4s when we've seen the scale of expressions of interest. So I want to move on now then to how the academy works. And again, I am talking you through the materials that are available in the prospectus, hopefully bringing them to life a little bit. Obviously, if there are questions, then I will deal with those at the end of my presentation. So, at the heart of the academy, as I've already said, is the Early Years Transformation Academy team. And we think this is likely to be around 6 to 8 individuals who are system leaders. Whether they consider themselves system leaders or not, they have a key role in the design and delivery of that local system. And we think that brings together both strategic commissioners and senior managers within key provider services. And we give a lot more detail in the prospectus about those roles. But there is a spread of interest which reflects the scope of the maternity and early years system, which needs to be covered by this Transformation Academy team. So this means that when we talk about strategic commissioners, we're talking about people in the local authority who are responsible for things like children's centres and special educational needs and disability services and early help. We're also talking about health commissioners responsible for maternity and mental health and neonatal services. And we're talking about senior public health consultants who may not be called commissioners, but certainly are important in the commissioning process, responsible for the Healthy Child Programme, health visiting, school nursing, and so on. In addition to commissioners, we think it's vitally important that key leaders of provider services are involved too, because this is a complex system. It's not a case of a purchaser-provider relationship. It depends on people trusting each other and working together. People who have that leadership role being able to work together. So in terms of provider services, we're talking about senior managers within children's health services such as midwifery, health visiting and wider children's health services. We're talking about senior leads for family support services, which may be in the local authority or in the voluntary sector, such as children's centres and early help services. We're talking about leaders across early education services, whether that is through nursery schools or private voluntary and independent organisations. We also recognise the importance of the voluntary and community centre in delivering family services, being part of this team working approach. Now, there are likely to be more than 6 to 8 key people who are leaders within this system. So there will be some compromises about who is available to sit around the table and participate in the detail of the academy. Some of the people that I've described may well be part of a wider stakeholder group, It's for the local area to judge who you need to bring together, what kind of compromises you need to take based on the availability of people, the capacity, and the other factors that I've already talked about. But there's something really important about the scope of that leadership team to influence the whole of the maternity and early years system. So the Academy itself works through 3 core elements. And again, these are set out in some detail in the prospectus, so I only want to touch on these briefly. But the focus of the Academy is on the red box, so the local application. That's the whole point of this, supporting the local leadership teams that I've just described to develop a change program that they can apply at a local level. It's very much an applied program. So it is about taking learning and ideas and applying them in the local environment. To help those local teams to do that, they will participate in design workshops. And the goal of these is that they're interactive and practical, again, the applied theme running through the program. It will give the teams an opportunity to work within their teams with each other, but also across teams. So where people are in particular roles across the 4 sites, they can provide peer support and challenge and work on things together where there's a common interest. We think that the cross-fertilization between teams, the sharing of ideas, is a hugely important part of the Academy. And to make sure that those design workshops can be applied and practical, we've pushed a lot of the core content, the evidence content, into online learning. And we're creating a virtual learning environment to help people individually access that evidence and other materials. This will allow people to work through the materials at their own pace. We recognize that people will come to this with different levels of knowledge and understanding in the range of different things that the Academy covers. So some people will only need a very brief refresher, whereas others will want to explore in more detail. The online learning environment that we're creating will help people to do that at their own pace. And the Academy support itself, I talked about some of these things already, but it provides that access to independent specialists, both through the Early Years Transformation Academy partners, but also through a range of other experts that we will bring in to support the development of the programme, including drawing on expertise across the 5 A Better Start sites. The Academy will be built around support and challenge, so helping people, giving lots of feedback, both from academics and other experts, but also the local experts, so people across the 4 teams to provide that support and challenge. And also some help bespoke to your local requirements, so helping you to deploy what you've learned through the Academy process, reflecting on the progress that you've made at a local level and helping you to apply it. And I talked already about the peer network across the 4 neighbouring sites. So briefly then, the Academy includes 4 modules, and these are not sequential. So they run in parallel depending on the particular topic and content that we think is important at the stage that we work through the Academy. But I wanted to say a few words briefly just to explain what those 4 modules are. So the first is preparing for change. And you can see in this slide that we've broken down the elements of this which are delivered through the virtual learning environment, the design workshops, and the local application. But essentially what the Preparing for Change module is about is focusing on your readiness for change assessment, so looking at the beginning, at where you're starting from, and thinking about what that means for your local deployment of change through the Academy. This module also looks at the development of the leadership role individually and collectively within your teams. It then takes you through to implementation planning. So giving you space and some structure to look at how you create a plan that's ready for delivery of the change process. The second module is identifying vulnerable populations. So I guess hopefully the logic of this will resonate at a local level. The critical component here is making things feel different and better for families themselves. So understanding the experience of families is the starting point for the Academy. So what this module includes is supporting the local teams to look at your current arrangements for measuring outcomes, whether that's through outcomes frameworks and population needs assessments, and bringing the latest evidence from our evidence reviews through tools like a model outcomes framework, a virtual benchmarking population needs assessment, and other tools which we think will be helpful. The goal of this module is to help you reflect on the current strengths of your arrangements for identifying vulnerable populations and to look at how you might improve them. Again, for some areas, you may have recently completed a population needs assessment, which is gives you the kind of detailed understanding of the maternity and early years outcomes for families, in which case you wouldn't need to do a huge amount of further work on your needs assessment. Whereas for other areas, it may be the reverse. So it may be that your joint strategic needs assessment is very high level, very broad, and just doesn't give you the forensic detail that you need to really understand the experiences of families with small children, in which case you will spend more time focusing on the development of your population needs assessment and testing that with the wider community. So system planning is the third module, this has the following components. So first of all, it helps you to look at system thinking and system concepts. So why is it important to focus on a systemic approach rather than on individual services, and what system thinking can do to help you to transform your local arrangements. It looks also at what kind of support is currently available for families and how you can bring evidence to bear to improve and strengthen your local pathways, your support pathways for families. And it also looks at what kind of capacities are needed to help you to deliver the system and the pathways that you're seeking to implement. And that covers a range of things from workforce or community capacities, partnership capacities, how you use resources, and what kind of technical solutions you might want as part of your local arrangements. The fourth module is measuring impact. Again, this, like the other modules, flows from the beginning all the way through the Academy. As you might expect for a What Works Centre, we are particularly interested in how we support local areas to generate the local evidence base and to strengthen the wider UK evidence base, not just for individual programmes or interventions, but also for system design and development. So this module will help you to understand key evidence concepts, to look at how you can critically assess evaluation evidence in particular, and will help you to put together an evaluation plan that will give you the kind of answers that you need about whether the things you're doing have really made a difference at a local level. So I want to move on now to the process for applying to be a Transformation Academy partner. The first thing I would say here is that we're working to a very tight timescale, and we recognise that that puts some pressure at a local level to participate. We've asked for expressions of interest to be with us by Friday next week, so that's the 15th of February. After that point, we will have individual conversations with each area, with sponsors from each area, to deepen our understanding about what you're trying to achieve and to understand better what the pressures and issues might be for you working with us as a partner. By the end of next week, or at the latest Monday following on from that week, we will contact the applicants that we've shortlisted, inviting them to complete a full application. And again, just to reiterate the point that I made before, each step of this process has been reduced as far as possible to make it proportionate to what we need and not too time consuming for local areas. We're asking for final submission of applications by Monday the 25th of March, and we will confirm the Academy partners that we want to work with at the end of that week. So by the end of March, we will have identified local partners. Just to say, the discussions with area sponsors is a crucial part of the process, because we want to invite a limited number of local areas to complete full applications. We don't want a lot of areas to be investing time in building full applications when there is very little chance of them getting through. We're only looking for 4 local partners to work with us. So briefly then, these are the eligibility criteria which are pulled out in the prospectus, but you will have seen reference to these throughout the prospectus, so this is just reinforcing some of the key points for us, I guess. The first is that when we're talking about local partners, we are talking about those with responsibility for maternity and early years services, so for that wider system of services. And as a minimum, that should include the commissioners of those services, so the local authority and the CCG. But for an application to be strong, it must include that wider set of stakeholders that we've talked about. This isn't really limited to the commissioners of that local system. We also talk quite a lot about local areas, and we're slightly cautious about being explicit about what a local area is, because we want you to define the local area that makes sense to you. For example, that could be defined by the local authority boundaries, but it could be defined by the CCG boundaries, or another way of describing that local area that makes sense to you. From our perspective, we expect that local area to be rational in terms of a system for maternity and early years. So it has to have the capacity to focus on all of the components that make up a strategic approach to that system. So it isn't sufficient to focus on 1 or 2 wards when most of the resources in that system will be serving other parts of that local area. It has to have that coherence as a whole area. The scope of the local system, and so the local response, should be defined by the family journey, if you like. It should be clear by now that we're not talking about organisational boundaries when it comes to this system. It's what makes a coherent whole for families. And that should include what families do for themselves and the role that community assets play in this. This isn't just about organisations, it's the balance between what organisations can do and what families and communities do for themselves. And finally, applications need to demonstrate some of the things that I've talked about already, that local partners are committed to working together, that they understand the demands that the Academy will place on you, and that you're open to sharing your learning with that wider audience that I briefly touched upon at the beginning, and that you can show that this work will help you to meet your local priorities, the things that you are already committed to do, rather than feeling like an add-on. Briefly then, submitting an expression of interest. As I've already mentioned, you haven't had much time to do this, so we are only looking for initial ideas. We recognise there's been limited time for stakeholder involvement in the development of these, and that some of the ideas that you want to include in your proposals will yet to be fully tested, and you won't necessarily have that full stakeholder buy-in to this. That's fine. We want to hear about it, nonetheless. We're looking for concise responses. We don't need to have a lengthy and detailed descriptions of exactly all the detail that might be relevant in due course. Tell us what your ideas are, and we can then follow up with the conversation afterwards. The expression of interest has 4 key questions. There are some other details that we ask for, but in particular, what we want to know is, what difference are you hoping that your involvement in the academy will make? So what impact do you hope it will have for your local area? Why is it important for you to participate in the academy? And when I say you, essentially I'm talking about your area. The second key question is your assessment of why the academy is right for you. And in particular, we point you back to section 4 of the academy prospectus, which looks like the next slide, which is finding the right local partners for the academy. So going back then to the previous slide, please. We want you to tell us in an open and frank way about where the pressure points here will be, and what the match is between the academy and the local area. This doesn't necessarily mean that you won't be able to participate if you identify issues that are challenges for you. It will help us to understand how to make the academy practical. But it's also really important that we're able to identify areas that can run with the academy, that can be active partners. We're asking you to help us to identify those areas, and to be honest with yourselves too about when this might just not be the right moment or the right kind of approach. We need to make sure that partnership relationship is right for you and for us. The expression of interest form also asks you to tell us who you would involve in the academy. Again, this may not all be tied down yet, so please do tell us about the roles if you haven't identified individuals yet. But this gives us a chance to understand better how you see the scope of your response to the academy, both at the senior sponsor level and within the Transformation Academy team itself. And we also ask you to set out what you think the risks are for your area's participation. Again, we want you to be frank with us. What could potentially hold you back, whether it's the time to participate, or current quality of relationships, or whatever the other risks might be for you, and tell us how you would propose to respond to those. Just be frank and open with us so that we can be clear about how this might fit for your local area. I guess the final point that I'd make on the expression of interest is that we're not approaching this as a traditional bid process or an application process. We need to bring some structure to it so that we can identify the right kind of partners to work with us. But we want you to be honest and open with us, and we will do the same in return so that the relationship can work over this challenging 12-month period. That brings us to the end of the content that I wanted to share with you. Obviously, there is more detail in the prospectus. I haven't gone into all of that, but really keen to see your questions now, if you have any, and we'll work through those.
Okay, so the first question we have is from Liz Olte, and this question is, what if there are no other local areas from our region interested?
Hello, Liz. Thank you for that question. I guess the bottom line is, if you are in Worcestershire and there are no other local areas in the West Midlands, then we won't be able to move forward with a single authority. We need a grouping of 4 authorities so that we can deliver the academy in the region. And that's why I mentioned that we'd talked to the regional chairs at the Association of Registered Children's Services to help do some of the brokering of relationships. We won't really have a sense in EIF, excuse me, about whether people are able to come forward in fours or clusters of authorities until we see the expressions of interest after the 15th of this month. But if you want to find out more about other authorities that are interested, I know that Directors of Children's Services and others have been sharing information about the Academy, seeing who else is interested. Some areas have been very proactive in seeking a cluster of 4. Talk to your regional chair of ADCS and ask them what the level of interest is and whether there are others who are considering putting forward a bid.
Okay, thank you. And I think you've answered or touched upon the other question from Liz, which is how can we identify interested local areas from our region? So if there's anything more you want to say, or feel like you've touched on that.
I guess one other thing to say, we're depending to a degree on the local networks. And so some of that network will be at the director level, as I've said, but some of it may be at other levels too. So talking to the colleagues that you know are passionate about system change in maternity and early years systems is likely to be just as important as the directors talking to each other. So I would certainly encourage you to talk to your peers across the region. Part of the full process for applying, as part of that process, we will ask areas to identify where in the region will be the best place to deliver the academy. So it's something that you can agree with colleagues in that region.
Great, and hopefully you should all be able to see Sarah Farmer's response, which is that Sandwell and Wolverhampton are also interested in the West Midlands. We're going to move on, so anyone that's having any difficulty submitting a question in the Q&A box, just feel free to pop that in the chat box and we'll be able to see that fine. So the next question is from Karen Hearn. This question is this only open to England counties or local authorities, or could Scottish borderlands be included?
That's a really good question. It's not something that we've considered up until this point. We're focused on England local authorities. But I guess if you have a strong case to make about why there would be a local or regional logic for partnering with across the border with a Scottish authority, make that case to us.
Okay, great. And then Karen's just come back with, please can you confirm again how many clusters of 4 in total the Academy will be working with?
We will only be working with 1 cluster of 4 authorities. So in total, we will work with 4 authorities in 1 cluster.
Great. And then from Linda, just a bit of clarity on the time commitment needed.
That's a really good question, and we've sought to respond to that to a degree in the prospectus, but I recognise that still doesn't make it crystal clear about the time commitment. What we've done is we've broken it down by the different components of the Academy. So we know how much time we'll be asking participants to commit to in the design workshops. So we've already specified those, and in fact we've given dates for when they will run in the prospectus itself. That's quantifiable. What is harder to quantify is how much time individuals will choose to spend using the online materials. That will depend on how relevant they feel to the role they're playing within that team, how familiar the materials are, and so on. What we're committed to doing is to make this as light touch and adaptable to the individual as possible, but it certainly will require a significant commitment to work through the materials and become familiar with it. The other part of the Academy is the local application. And again, this is extremely difficult to quantify because it depends on the priorities of the local area, how much change they want to make to their current local arrangements, how much involvement of local stakeholders they need to do that. I mean, I already gave the example of the population needs assessment and the contrast between an area that decides they don't have a huge amount of change to make versus another that wants to start from scratch. The same is true of the system pathways work. So it may be that you already have done extensive work on mapping out your current local arrangements for supporting families across a range of relevant pathways, and that you just want brief review and confirmation of those. For other areas, it won't feel like that at all. It'll be far more systematic. I guess the reality is, if you feel like you have many of the components of this already lined up and done, then the Academy probably won't give you the added value that you need. If the Academy is going to give you real added value, it's going to take more time for the participants. The challenge for us is being explicit in quantifying exactly how much time that would be.
Okay, great. So we'll just go over to two questions from Rob Newton. So the first one is, can you give examples of partners or wider stakeholders that you would like to see in a strong application?
Yes, I'd refer you back to the section in the prospectus, which talks about the roles that we think are important to the core Early Years Transformation Academy team, and the sponsors, the senior sponsors relating to those roles. And I guess the other factor which is really interesting to us is the relationship that I touched on between what organisations do and what communities do, that interface between the two.
Great. And then the second question from Rob was just, will there be further opportunities in the future?
We really hope so. So we're funded to run the Academy until the end of March 2020. And as I've said, this is a test and learn for us, hence it being a relatively limited opportunity for 4 authorities. We have the capacity to run the programme and support participants in this relatively small scale way at this stage. We're really interested to learn from this first phase and to look at whether there would be further cohorts, but at the moment we simply can't make that commitment.
Okay, and then moving on, so we have a question from Sheila Marley. So this is about something that's pre-existing called the school readiness model, which is jointly earned by early help and health, but this model could be so much stronger if we identified wider partners to engage and help consolidate systems. So the question is this something we could do using this framework?
Hello, Sheila. It's possible. I guess the question, it takes you back to the question of how fixed your system design is now, and whether the issue is about getting people to comply with that, or whether you still need further innovation, and it's helpful for Middlesbrough to review the process and approach. If it feels like participating in the Academy might take you back 2 or 3 steps to do things that you've already recently done, then it's just not going to be a productive use of time. So it's just reflecting on the stage of development for you locally, and whether it's a good fit for the series of stages that we've described in the modules.
Okay, great. Another question from Karen then. So can you share if any of the areas in the northeast have verbally expressed interest, so we can start making tentative inquiries and know if it's worth submitting an EOI in the first instance?
I would suggest that you make contact with the regional chair of ADCS, who has in fact said that there is a strong interest across the region. So I think you would be talking to someone who is already familiar with what this offers, and may well be talking to other authorities at the moment anyway. So I'd make contact with him.
Okay, and I think this is a final question, again from Sheila. So in terms of needs assessments, we have a JSNA in place, and I've recently used a mosaic approach to profiling all households with children under 5 in Middlesbrough. Is this something we could also use as evidence of a clear needs assessment?
That sounds really interesting. Certainly sounds like a strong approach to needs assessment if it gives you the kind of detail that you need for in the maternity and early years part of your local system. So I guess the question is, again, the same point as before. Do you feel like you've already done what you need to do, looking at identifying vulnerable populations? Would it feel like moving through these steps would just repeat things that you've already done?
Okay, so those are all of the questions that we've had submitted. If anyone wants to submit any more, we'll hang on for a couple of minutes, and if not, I suppose if any questions come to mind in the next day or so, then there'll be opportunities to express those. And for now, I don't know if there's any final things you want to say, Ben.
I guess just to say, this is a really big piece of work for EIF. We're hugely excited about it. It's the culmination of a range of things that we've been doing since the organisation started, both in terms of generating evidence and working with local areas. But it was so clear to us that we needed to bring all of this together into a coherent whole system approach. So we're really looking forward to working with local areas, but please do be honest with yourselves about whether the kind of intensity that's contained in this programme is manageable for the local area. We're very sensitive to the fact that this requires a lot of commitment, and there is huge pressure at a local level on capacity and resources at the moment, and it simply won't suit some local areas. If you do want to test that out further, there'll be an opportunity to do that once you put together your expression of interest. But I'm very happy to respond to subsequent questions. I think the prospectus itself points you towards the info@eif.org.uk inbox. Don't feel like you've missed your opportunity if you haven't asked a question now. If there's something that feels important in the development of your expression of interest, so at this very stage, then do get in touch.
So I'll just flag the two questions that have just come in. So we've got a question from Linda, just wondering if it's helpful for EIF to understand why people may not apply, for example, short notice, capacity of maternity. I think that's something we've touched upon. And similar question from David, maternity and early years provision in London aren't really linked, maternity shared across multiple boroughs, etc. So this feels like a barrier. Any thoughts?
The first point about people not applying, that is helpful to us, and certainly if you make the decision not to apply at this stage, then but you would have otherwise given more time, then do let us know. We will do some debrief anyway, probably through regional organisations, to explore what the limitations of the approach that we've taken have been, and obviously we will be doing evaluation all through the process. We're very upfront about the fact that the timescales for this are tight, and that is going to affect the ability of some areas to participate. The reality of this is that it will suit areas that are already thinking about this journey and have now heard about the Transformation Academy, and it helps them with something they already wanted to do. So they'd already made a commitment to focus on the early years, or potentially maternity and the early years. For areas that need a little bit more time, that are excited about this but would have needed more time to bring together a set of stakeholders to build commitment, it's a less good fit, and we recognise that. The second question then around maternity and early years provision in London, I think that takes us back to the question about what a sensible local area looks like, and what the rationale for a configuration of a regional approach looks like. We have left the door open to a regional approach which does vary, taking account of regional priorities, and I think that's certainly the point that you're making here, David, feels relevant. So how to make sense of a maternity provision that spans a number of different authorities. We're very interested in how you could make that work for us. I'm unclear at this point whether that would be a deal breaker for this kind of model. If you wanted to talk that through in a bit more detail, then get in touch.
Great, so I think that's just about all we have time for. Thank you all very much for joining. Hope it's been helpful. Someone asked a question about when we might be able to send out the recording of this webinar. So feel free to get in touch and we can send that directly, or it will be posted in a link on our website. So do look out for that.
But finally, just thank you very much for joining us and for being interested in this work. It's been a labour of love over the past 18 months just to get to this point. So we're really pleased now to be sharing it with you, and really look forward to sharing the onward journey. I haven't really talked about the wider learning strand, but we hope that that many of you will be able to join us in the events that we're running in the spring, and we hope to run some more in the autumn. And we will be publishing the tools and learning and other information in the new Early Years Transformation Academy Hub, which at the moment holds the prospectus and information about the events. That will continue to grow and develop, so please keep an eye on that.
Great, thanks again, everybody. Any final questions, we'll just check and nothing's come through. So thanks again, and let us know if you have any subsequent questions.